thinking about mold, I'm thinking about how it can be affecting my patient in various ways. I'm thinking, are they allergic to the mold spores themselves? For that, I'm looking at mold IgG allergens, not IgE. We can look at IgE too, but usually they come out zero. And looking at, right, and looking at the IgGs, that's where we're seeing the possibility of a sensitivity. And we learned this from old ENT doctors who actually taught us that as doctors at Gordon Medical back in the day, they taught us that the IgGs are the ones, are the proteins that we make in response to seeing mold when we have a sensitivity to it. So I'm looking at that. Do
you do that through the LabCorp, or do you use one of the specialty labs?
Just LabCorp. Yeah. I don't have the specialty lab that does it, but it's good that most people's insurance covers that.
Which is
I noticed, which is great. And so I'm wondering, do they have an allergic response to the mold itself? Then I'm wondering, do they have a high load of mycotoxins? And then I'm wondering, do they have an allergic response to mycotoxins? I'm wondering, where is the mold? I'm wondering, do they have an exposure, a current exposure? Where is that exposure? So there's so many things I'm thinking about, I'm considering when I'm diagnosing my patient with mold or mycotoxin illness. So there's many tests for all of these various possibilities. So mold IgG allergens, like I said, to understand if they're having an allergic response to the bug itself. To understand if they have a high mycotoxin load, I was using Mosaic and Great Plains. We can look at IGL now to understand that. To understand the location of where that mold is, I'm thinking about the gut. I'm thinking about the sinuses. Where's the skin? And so in testing the gut, where there's so much testing to do, I'm looking to see if there's funguses in the gut. I'm looking for them in the sinuses. I like the microbiology DX test for the sinuses, where we can look for bacteria, funguses, mold, biofilm. And for the gut, we can look at, I like the parasitology center test for two reasons. They're more sensitive for candida in the gut, but they also will, they'll find the nematodes of parasites. So earlier on, I talked about how parasites are common in this patient population. They sure are. Most PCR tests, great PCR tests, can't pick up on parasites, because within 2 hours of somebody pooping, parasites send out an enzyme that makes them disintegrate. So we can't find them on the PCR test. We can't get that stool sample to the lab within 2 hours, right? Yeah. So the parasitology center test in Mexico, I don't envy the person their job, but they're using equipment to manually look through the stool to look for eggs. So it's very often I'm finding the eggs of the nematodes. And when I'm finding the eggs, inevitably I'm finding the candida, because remember, parasites sequester